Hey there! I'm so excited that we can dive into pancreatitis today. So stick around as we go through this step by step. Now, I created something just for you. When you click that description box below, you're going to find these free MedSearch templates. Now, I designed it in such a way that you can actually write your notes in a concept map format, and instead of just listening to our videos, you can actually follow along. Or if you don't like these templates, you can actually download our pre-made study guides. This is the MedSearch version, over 100 summarized conditions already laid out for you. So click that link, everything is there. Great, now let's start. So in order for you to understand what is really going on in terms of the pathophysiology, the causes in pancreatitis, it's important that you understand the physiology first. So here you go. The pancreas has two jobs. This guy is just going to do two major things. That is the exocrine function and the endocrine function. So when I say the exocrine function, that means the pancreas is going to release digestive enzymes into the small intestines, and that is amylase, lipase, and trypsin. Now this is used to break down carbs, fat, and protein. And the endocrine function, this is what we normally know, right? The insulin and the glucagon. It's needed to regulate the blood glucose levels. Now, it's important to know this and also to note that inside of the pancreas, these enzymes are not active. They are asleep. But when they are released into the body or into the digestive system, then it becomes activated. So inside the pancreas, they're all chilling, they're all asleep. When they are released, then they become activated. So what is pancreatitis? Let's break it down. Itis means inflammation, and we know of the pancreas. So pancreatitis is inflammation of the pancreas. But here is what happens. Instead of the pancreatic enzymes to be activated when it is released from or outside of the pancreas, it becomes activated inside the pancreas, and we don't want that to happen, because when it is released or activated inside of the pancreas, then you're going to see things like autodigestion, inflammation, edema, and necrosis. So here's where all the problem will begin. Now, what is going to cause this pre-activation of these enzymes inside of the pancreas? The most common one that you need to know for your exam is gallstones. What it will do is that it is going to block the pancreatic duct, causing that accumulation of all of these enzymes inside of the pancreas. They will try to be released, they cannot come out, and so they will start to activate inside of the pancreas. Number 2 is alcohol abuse. It is going to damage the pancreas. And number 3, it's idiopathic. That means no known cause. Let's go over some 5 of the main signs and symptoms that you need to know. The first one is pain. So the patient will experience pain, but the pain is going to be in the epigastric region. It will radiate to the back, and oftentimes after a heavy meal, or even in your exams, you're going to see after a meal that is very fatty, okay? And that's because after the meal, these digestive enzymes will be what? Producing more and more, and now they are activating inside of the pancreas. Number 2 is nausea and vomiting. Number 3 is abdominal tenderness and distension. And in chronic pancreatitis, you're also going to see oily stool because of the fat. Number 4, low-grade fever. Anytime there is inflammation, there will be fever and tachycardia. In pancreatitis, you're going to see something new, and that is colon sign and gray Turner sign. That is discoloration around the umbilicus, so that is the colon sign, and then discoloration at the flanks, that is the gray Turner sign. Diagnostic test. What are we going to look at? The first one is serum amylase and lipase. Then again, these are the digestive enzymes, so obviously we're going to look at that. We'll also look at the white blood cell count, and that's because when there is any inflammation going on, you're going to see that it will be elevated. Then the blood glucose. Let's think about it. I said in the beginning that the pancreas has two jobs, okay? The endocrine and the exocrine function. Now with the endocrine, remember that it needs insulin, but once the pancreas becomes damaged, insulin will not be working properly, okay? Because there is something wrong with the pancreas. So that's why you're going to see elevated glucose. And lastly, we do a CT scan and an ultrasound. We want to look inside. We want to see what is really going on wrong inside of the pancreas. Management. What are you going to do as a nurse? Number one, maintain NPO. We don't want to give them any more food because we know that it's going to cause more pain and the pancreatic enzymes want to be released, right? So we want to rest our pancreas. So that's very important. Rest the pancreas. Number two is IV fluids. Now, once a patient is on NPO, we give IV fluids. We want to prevent dehydration. Number three, pain management. We want to maintain this pain. And where is this pain located? In the epigastric region. Great. Number four is electrolyte replacement. Now we are going to replace calcium, potassium, and magnesium as needed, okay? So you need to remember this, especially calcium, when we're talking about pancreatitis. And then position the patient in a semi-Fowler's position or sideline with the knee flex. Again, this will help with comfort, okay? Monitor signs of shock because there can be internal bleeding, and that's why sometimes you will see the colon sign and the gray Turner sign because it may show that there is some bleeding going on. And the diet. Now, when the patient is stable, we will educate our patient on a low-fat diet, okay? And that's it. That's all about pancreatitis. So let's just go through some quick tips that you need to know for your exams. All right, first, the priority is always NPO and IV fluids. Remember, we want to rest the pancreas. Number two, look at the amylase and the lipase elevation when you're looking at the diagnostic test, especially lipase. That one is most specific. The colon and the gray Turner sign, as I just mentioned, shows that the patient may be bleeding internally, okay? And then, that's why I talked about calcium. Look at calcium because in pancreatitis, the patient will have hypocalcemia. And the signs that you can see, maybe your exams will not mention hypocalcemia, but maybe you will see Trousseau sign and Vossick sign. That's pointing you towards what? Hypocalcemia. Then shock, monitor for shock. You want to educate your patient, no alcohol, because we know that that can damage the pancreas more. The comfort position is semi-Fowler's position or the knee to chest position. And then encourage your patient to have that low-fat, frequent, small meals to prevent these enzymes to be stimulated. All right, glucose monitoring, again, something is wrong with the insulin because the pancreas is damaged, so remember that. And we can also place in an NG tube because we want to rest the pancreas as well. And that's it. That is all that you need to remember for your exam for pancreatitis. Don't forget to click that link below, grab your templates so that you can write your notes. And now I know that you will be able to pass your exams whenever you see pancreatitis. All right, see you next time.